Thank you very much. And my name is Dr. Iacopo Olivotto. I am chairing this session with Dr. Ciaccuni. And it's a real privilege for me to be here as well. I am from Florence, and I have been collaborating with local faculty here and Professor Iacopo for some time now. I would just like to still promise to you 2 minutes to introduce the topic and to begin the interaction in the session. This is just to show you how really controversial the topic is. There are very few issues that are as hot and as controversial as revascularization in coronary disease patients. And just to bring up the topic, I would like to share with you a poll that was held in 2007 on the New England Journal of Medicine and present a case. So they presented a case of a 65-year-old man with hypertension, obesity, and type 2 diabetes. I wonder whether you've ever seen any of these here, who presented with a 2-week history of exertional angina. He underwent an exercise SPECT, which shows a fixed anterior defect and a reversible anterolateral defect, both of moderate size. His subsequent cardiac catheterization revealed an occluded first diagonal branch with a long lesion with 70% stenosis in the mid portion of the LAD, calcified lesion with 80% stenosis in the proximal circ, and 50% stenosis of EDA. So complex anatomy here. These findings were accompanied by anterior wall hypokinesis and an ejection fraction of 45%, so mild left ventricular dysfunction. And the readers were asked to answer, indicating what their preferred treatment option would be here. So treatment option 1 would be obviously optimal medical management. That applies to all the options. And close follow-up, so no further action. Just treat the patient medically and observe over time. Second option would be optimal medical treatment and PCI. And the third would be optimal medical treatment and CABG. So let me just go through the audience. Let me make it very clear. There is no exact or wrong answer in absolute terms. So you can, no matter how you answer, you will never be totally wrong. So how many people would just treat medically here in the audience? Just drugs? Nobody. Wow. So you must be very aggressive. So how many people would go for PCI? Okay, fair amount. I would say 30%. How many would go for CABG, cardiac surgery?
Surgeons go for cardiac surgery.
Well, that's the point. So how many? So somebody never raised his hands. But anyway, so that's very controversial. Let me show you the results. So 7,000 people responded. Okay, 7,000 people around the world, and you see here that medical option following the COURAGE trial was considered to be appropriate as a first step. So by actually a majority of physicians. So most people would just around the world simply have given the patient drugs and then followed up. The second favorite was CABG, and low down here was PCI. Okay, and this is pretty homogeneous around the globe. So in Europe, Asia, North America, the ratios are similar. Okay. Maybe some of this has changed following recent evidence from trials, and this is what we are going to hear very, very soon. So it's my pleasure to introduce to you Professor David Taggart as Mike